It has dramatically changed. I would say over the last 10, the equipment is so much better. It is more flexible. It is less traumatic. There are variable sizes. And the advent of anesthesia with different medications or the use of either a CRNA or an anesthesiologist has allowed us to be able to do colonoscopies where people don't have such a traumatic after effect in terms of how they feel, that hangover quote feeling. They really don't have that so much anymore. People are able to function. Now, there's limited things you're allowed to do when you're sedated later on that day, but at least you're able to function, and the next day you can do whatever you want. I have quite a bit of a personal history in this matter. My grandfather died of rectal cancer, and unfortunately my father-in-law in the last 6 months died of colon cancer. So it's a very personal issue to me. And the one thing that colon cancer has that a lot of cancers have to a degree, but especially colon, is it is preventable. If you get your colonoscopy when your screening methods occur, if you get your colonoscopy when your time is right for screening, or if you have symptoms, get to people early. You can get checked. Polyps can be removed that never transform into cancer. And those are the things that we emphasize so much to patients, employees, family members, hospital personnel. The resources are available. It is not like it used to be. People are always worried about the prep. That seems to be a common misconception that this horrible prep exists. The preps are better also. They have also come along with the times. There are pill preps. There are low volume preps. It just depends on your physician, what they like to use, what your own medical history is, and how well you can tolerate it. But there's always ways to work around that. But the ultimate goal is prevention. So we don't have statistics of the number 3 killer of men and women in the United States. We want it to be non-existent. What we do know is that we're picking up more cancers. Okay, so innately some people in the olden days would have just, quote, died, and some of those may have died from colon cancer but never got checked because it had already been spread somewhere else. But we're catching more and more people at earlier stages, so we're able to know that, hey, this frequency exists both in the urban population and in the suburban population. We know that we are catching more and more colon cancers as time goes on with screening methods. Because of that, and you're getting them earlier, people are living longer. We know that our data is improving. Now, for the people that are unfortunately a little bit further along the process with either disease that has spread to another organ or disease that is beyond the early levels, our oncology colleagues are also in trials or are investigating new methods of keeping people on a functional basis and on a long-term basis healthier, and they can live longer. And so it is not a death sentence if you get colon cancer, but the goal is to not even get it. Just get your colonoscopy done, follow your physician guidelines, go over the history of your family. If you got siblings or uncles or aunts, ask questions. It is such an easier process than it was before.